So before I address what types of tests I would do in infants and preschoolers, I will say that the breathing tests that enable one to confirm a diagnosis of asthma are typically available only in a school-age child. There are some tests that can be done in children as low as 3 years of age. Even then, half the kids can do it, and the other half still can't do it. And those tests can give you a little more information about whether or not this is asthma. But certainly below 3 years of age, it really comes down to more invasive, difficult, challenging tests. And from my perspective as a pulmonologist, if the symptoms warrant it, if there are radiographic abnormalities, either on a plain chest film or on a CT scan, or in particular, if there are other symptoms unrelated to breathing that I think I can connect up and make a case for this is all the same process, just having different manifestations in the belly or in the lungs, then I would go to bronchoscopy. That's a test that only the pulmonologist can do. It involves a general anesthetic. We want your child to sleep during the procedure. It involves inserting a long flexible tube about the thickness of in babies, the cord on your mouse. In older kids, probably the thickness of the telephone cord, where we can sample, have a look at the lower airways, the bronchial tubes, get a sample of the secretions there. And that's, in my opinion, the definitive test when you're trying to figure out why a child is either having persistent cough or noisy breathing. Sometimes while they're still under anesthesia, if the child has a history of vomiting or other belly issues, I may also combine the anesthetic procedure with a test for reflux, which involves putting a very fine tube through the nose down into the stomach, and it stays there for 24 hours. So that's called an esophageal impedance test. When your child wakes up, they'll have that tube coming out their nose, and they actually tolerate it pretty well. Just give them whatever they want to eat for the next 24 hours, let them chow down, and we get a lot of data from that and information from that test. Sometimes it comes as a big surprise to everybody involved. And the tube's removed after 24 hours, and I'll put together all the results of the bronchoscopy, the esophageal impedance test, any radiographic findings. And then I don't always have an answer, but at least I can tell you this is definitely the most likely thing, and we've excluded possibilities A and B. Let's work on C or D, and that's how I approach this problem.